What happens if you turn 65, become eligible for Medicare, but you have a younger spouse, younger being under 65? How do you deal with the health insurance issue? Hi, I'm Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Well, let's talk about that for a moment. Basically, if you have a younger spouse and they have been covered under your group insurance plan, now if they have their own individual Obamacare plan, it's not an issue. They can continue that coverage until they turn 65. But if they have been covered as a dependent under your group insurance plan, well, that becomes a bit of a challenge. One of the options obviously is COBRA. COBRA can, in most cases, continue for up to 18 months after the employee leaves their work. So that's one option. And obviously with COBRA, you get to continue the same coverage that you had before, the same networks and deductibles and coinsurance and all that kind of stuff. So, there's a positive there. The downside is that the COBRA may be expensive, but the upside is it's probably a heck of a lot less expensive than Obamacare. It's not unusual to see people who are late 50s, early 60s paying $700-800 a month or more for an Obamacare plan with a $7,000 deductible. Most of the deductibles under COBRA are going to be a lot less. Premiums for a dependent may be in the $400, $500, $600 range, but you need to check this out before you make a decision and pull the trigger. Again, COBRA will run for up to 18 months. After that, if that younger spouse is still under age 65 and is not eligible, then you go into Obamacare. The good news is there's no more underwriting. The bad news is because there's no more underwriting, rates are about 3 times higher than they were prior to 2014. So the Affordable Care Act has created unaffordable health insurance for most people. If you're low income, then there's a possibility of some subsidies there, but most people are going to pay the full premium, and it is pretty hefty. So unfortunately, those are your choices. If some agents you talk to may try and squeeze your younger spouse into a short-term medical plan or some kind of indemnity plan that leaves a lot of gaps if you have a major claim. Don't get involved in that. Your only choice really is an Obamacare plan, and because essentially all of the agents have left the under 65 health insurance market, your best shot is going to be to go to healthcare.gov. It's not the best in the best of choices, but it's your only choice. This is Bob Vineyard with the Georgia Medicare Minute. Take care. Have a great day.